Hi, this is my presentation on cognitive behavior therapy. And so what cognitive behavior therapy is, it's just a psychological treatment that has been shown to be very effective for just a range of different problems. It can range from drug and alcohol abuse to anxiety and depression. And then it has been created on research and clinical practice, so there is very significant amount of evidence behind it to back it up that it is very effective in a positive way. And then the methods for CBT are actually a little bit different than other forms of psychology treatments, just because CBT, or cognitive behavior therapy, is focused a lot on helping a person change. Instead of just treating something, it wants to help a person change and help a person grow. And along with CBT, it helps you recognize the different problems that you're creating and kind of helps you learn how to recognize those and learn how to stop from creating these problems that may not actually be there. Just some core principles about CBT is it's based on focusing on unhelpful ways of thinking and unhelpful patterns or habits that have been learned and changing those. So CBT wants to take the negative thoughts that you have a lot and just focus on changing them and changing your mindset to be more of a positive mindset. And then it also focuses on helping people learn how to cope. And so this, I always think of it like a toolbox. Instead of just telling a person what to do, CBT wants to give people toolboxes so they can continue to learn how to cope with it and use their own problem-solving skills to learn how to deal with these different emotions and feelings and disorders that are in their life. And then it just encourages a growth mindset and the idea that you can change. And this is a very important part of CBT, because you have to be willing to change. Like I said, you have to be willing to change these unhelpful habits that you have in order to better yourself and work on these different mental problems that you may have. So just a couple, obviously these aren't all the goals of CBT, but just a couple of the goals is learning to recognize when you are creating a problem that's not actually there. I talked about this a little bit before, but this would be kind of just an example, would be when you are talking to someone and you're like, oh, well, they just don't like me. CBT would have you go back and look at the different events and be like, well, why do you think that? And more times than not, you start to understand that they actually may not have a problem with you, it's just a problem you were creating. And then using your problem-solving skills to cope. This is just helping you use your toolbox, like I said before. It's helping you take control of your mental state, and it helps you recognize different things and be able to overcome it on your own. And you learn to become more self-reliant, and in turn it just betters your mental state. And you also develop a greater sense of your own abilities as you do this. As you recognize that, like, you can overcome these things on your own, you don't always need someone, you start to understand that you have these amazing abilities and talents and strengths that you can use. And everyone is going to have strengths and weaknesses, but CBT wants to take those strengths and help them overcome your weaknesses. And then just a couple strategies that CBT uses is facing your fears rather than avoiding them. And this is a little bit different than like exposure therapy, because I always use the example of if you have a fear of spiders, you're not gonna immediately go and hold a spider, because that can actually make your fear worse rather than help it. But if you go and you have a fear of spiders, you're gonna start by looking at a picture of spiders, and then it will build up to maybe like a video of watching spider, and it's gonna build up to that point where you hold the spider. And that's how you're going to face your fears. Role play is also a very common one to be used in CBT. And this is basically you're acting out certain interactions with others. And when you do this, you're able to find what triggers certain emotions. And once you can recognize these triggers and these things that affect you in that way, you're able to kind of limit them and limit your exposure to them. And obviously you can't limit it all the time. You can't control what other people are going to do. But then when you notice yourself feeling a certain way, you can recognize that trigger and kind of talk yourself back, and not freak out as much as you would prior to you working on CBT. And then learning to calm your mind and relax the body. This is also known as mindfulness. And this would be, a lot of people, you can sit or lay down, and there's videos on YouTube or different, like Spotify, different streaming services like that. And you can sit there and you can have someone talk you through, or you can just sit there and just be in silence and just calm your mind and relax your body. And this helps a lot with anxiety. It helps you be present in the moment you are now and not focus on what did happen or what could happen. You're just focused on the now, and it helps calm a lot of anxiety. Okay, so some teaching connections that CBT and teaching can really work one-on-one, and it can actually be really beneficial for teachers to know CBT. It helps a lot with classroom management. CBT can reduce rowdy behavior in the classroom because you can limit stimuli that sets off your students' behavior. You're not going to be able to get rid of all distractions and everything in your classroom because you can't control every single one of your students and how they're going to act, because we all have agency. But you can learn to limit them. This would also relate to being a master of attention. Being able, when you see a student that is about to maybe set off another student, you can take the attention away from the student that has this rowdy behavior and try and keep the rest of the classroom in a calm state. That'll help a lot with classroom management, instead of just one student freaking out and then 5 minutes later your whole class is, because they're all kind of set off. And then I'm actually going to jump to the last bullet point with this. It's important to teach students, though, not to let their circumstances make them react certain ways. This is going to be kind of like your circumstances shouldn't make you who you are. You should teach your students to learn different coping ways to cope when a student is acting up. That you should teach them different ways to back themselves kind of off that cliff and to recognize, okay, I'm about to be set off. I need to go ask my teacher if I can go for a walk in the hallway, or I need to go and I need to doodle on my paper. You need to teach your students different ways to cope with what's happening around them, rather than just letting themselves react to their environment. And then it helps regulate students' emotions and behavior. As students recognize certain triggers, it can help them kind of back themselves off the ledge. It's easier if one of your students is feeling very upset and very mad. It is easier to kind of back them up from this big emotional breakthrough that they're going to have if you can identify the trigger. So if your student is about to freak out, you can go over to them and be like, okay, we're feeling this way because this happened. How are we going to not let that? And you can kind of back them up when you can find the root to the problem. And then these were the resources I used. Both were really good papers. Highly recommend reading them. They both had very valuable information about CBT in it. Thank you.